This is the third of 4 sessions that the department is holding to hear feedback from our customers in terms of how we can improve our business processes and assure better customer service. So we are going to kick it off here with introductions. My name is Carrie Armijo. I'm Deputy Secretary of the Human Services Department. With us this morning, we have Angela Medrano, my fellow Deputy Secretary at HSD. We have Jeremy Toulouse, the Director of the Child Support Enforcement Division. We have Sean Pearson, the department's Chief Information Officer. We have Ryan O'Connor, who works in the Office of the Secretary and is helping manage our presentation this morning. Sally Jameson, also who works in the Office of the Secretary, who is helping us with timekeeping and record keeping at this morning's session. We have Ashley Espinosa, the department's Public Affairs Coordinator, and we have Audrey Cooper with us. Audrey is an HSD Policy Fellow and registered nurse who will facilitate HSD's questions and request feedback from the audience toward the end of the session as we get feedback from you all. Before we kick off the presentation, I'm just going to review some ground rules for you all, primarily just to sort of let you know how the session's going to run this morning. We are recording the session and we intend to post it on YouTube at a later date so we can make the session available in closed captioning format. So we did want to make sure that our audience members know that this session is being recorded just for purposes of being able to make sure the department has a thorough record of the discussion and also so we can post the discussion on YouTube. In order to keep the session manageable, everyone but the presenter will be muted until we start the question and answer period. Comments can be submitted in the chat box during the presentation, and you can see the chat box in the upper right-hand corner. There's a little thought bubble there that if you click on that, you'd be able to submit a comment. HSD will be opening up the session to hear feedback from the audience, at which point we can unmute you to offer input. If you have a comment now, please submit it, or you can wait until we've opened up the session for audience feedback. At that point, if you would like to speak, just ask in the chat and we'll unmute you. We want to make sure that everyone has a chance to speak and to make sure we give your questions enough time for discussion. And so we respectfully ask that you keep your comments to no more than 1 minute if possible. Depending on the size of the audience, there may be more time than that. So we are flexible on that, but we just want to have some parameters around timekeeping this morning as well. Questions or feedback about very specific or personal issues related to specific issues that you need follow-up on from the department may require some additional research on our part before we can follow up or answer. So we will capture your question and contact information so we can make sure we follow up with you after the meeting is over. And finally, we just want to make sure that we maintain a respectful environment for everyone involved. So please keep your comments respectful. Thank you. Okay, so we'll go over the agenda for this morning's session. Oh, can you go back, please? We're going to, this morning, we'll review the goals of the listening session. And then we're going to talk a little bit about HSD's recent changes to customer service delivery, primarily in response to the COVID-19 pandemic and how that has driven some recent changes for HSD in terms of field office operations, behavioral health and Medicaid changes, and of course we'll talk a little bit about COVID-19 emergency operations. And then we're going to spend most of the time this morning asking you some questions and getting feedback from the audience. Our primary goal today is not to be talking, but listening. Next slide, please. We wanted to spend a minute this morning talking about HSD's mission and goals. One of the first priorities of the new administration that started in January of 2019 was to create a mission statement and goals that would reflect the priorities of the department and guide our work over the next several years. The mission statement and goals were developed through an interactive process that involved HSD employees. And a new survey requesting feedback about the mission and goals was completed, just completed recently. And the results indicate that we should keep working toward the same goals over the coming year. The mission and goals are really important because they do drive the work that we're doing at HSD, and we want to hear feedback from you today about how we can improve our business processes to make sure that we're making progress toward our mission and goals. So I'm just going to spend a really brief minute reviewing this slide to familiarize you all with the mission and goals of the department. HSD's mission really is to transform lives. Working with our partners, we design and deliver innovative, high-quality health and human services that improve the security and promote independence for New Mexicans in their communities. That is the overarching goal of the mission of the department, and that's what we're always working toward. Our specific goals for the coming years are, number one, to help New Mexicans. Our goal is to improve the value and range of services we provide to ensure that every qualified New Mexican receives timely and accurate benefits. Second, we want to make sure that we communicate with you effectively. We want to create effective, transparent communication to enhance the public trust. Third, we want to make access easier. We want to successfully implement technology to give customers and staff the best and most convenient access to services and information. And fourth, we support each other. Within HSD, we want to promote an environment of mutual respect, trust, and open communication to grow and reach our professional goals. So those are the primary things that we are working toward and where we want to get your feedback today. Next slide, please. So the goals of these listening sessions are, number one, to receive feedback about how well HSD is meeting its mission and goals, as I mentioned. Second, we want to hear from customers about what we can do to improve our business processes. Third, we want to learn from you about what we can do to make it easier for customers to access the services we offer. Fourth, we want to listen to input about how we can improve. And fifth, we want to find out the best ways to communicate with our customers. Next slide. So these are the questions that we are going to ask you today, and we're really hoping to get feedback. We know that this forum is new. It's new to us as well, but we hope that we will get a good discussion going this morning. What we want to hear from you today is feedback related to these 5 questions. What is going well at HSD? If you could change just one thing at HSD, what would it be? What innovations do you suggest for improving HSD? How can HSD make it easier for our customers to access our services? And how can HSD improve its communication with you? So these are the 5 questions, and we'll be handing this off to Audrey soon so that she can facilitate your answers to these questions. Next slide, please. So before we hand it over to the question and answer period, I'm going to ask Jeremy Toulouse to talk with you all this morning about some recent changes that HSD has made to change its customer service delivery. Take it away, Jeremy.
Awesome. Thank you, Carrie. And good morning, everybody. I'm Jeremy Toulouse. I'm the director of the Child Support Enforcement Division. So, first and foremost, COVID-19, as everybody knows, has drastically, changed the landscape of New Mexico and how we do business, and HSD remains committed to helping New Mexicans receive the benefits and services that they need during these trying times. So we've done many things at HSD to try to make sure that this is what is happening. I think in Support Division, as you can see, they've changed their model a lot to make sure that we're where our customers need us to be, so that access is improved. They've modified, ISD has modified our service delivery model and increased call center staff and online application ability. And HSD has also used the public health crisis as an opportunity to expand access to services and benefits. And we'll talk a little bit more about waivers, as this goes on. Please, next slide, Ryan. Child support enforcement, we're in the middle of modernizing our program. So this has been an opportunity for us to, take some big steps forward. One of the big ones for us is, we're taking warm handoffs through the call center so that you can better reach our caseworkers now to get the questions, to the answers that you have. We've also modified our service delivery model, by, going with curbside service, the same as income support division, which we share in many buildings. We've limited our lobby hours to reduce in-person contact during COVID-19 emergency. We've been doing virtual court hearings. We've also recently implemented an online payment pilot in one of our offices that we're hoping is really going to, allow people to avoid having to come into the office if they don't need to. And we've also, we're really working on increasing, how we communicate with our customers through telephone and email. And we're working on a new computer system that it gives us new abilities to manage your cases online. Next slide, please. Behavioral health division, health and safety of employees and customers is a primary goal while continuing to provide critical services. The Behavioral Health Services Division has enabled telephonic visits and established the New Mexico Crisis and Access Line, which supports individuals and communities during this time. This service delivery model has prepared us to appropriately respond not only to mental health concerns, but also to the COVID-19 outbreak. The NMCAL offers professional mental health services and access to resources, which has been really important in the shelters that we've set up at HSD for the emergency, which we'll talk about a little bit more later. Next slide, please. Medicaid has worked, New Mexico provides services, Medicaid provides services to, going on 1 million New Mexicans. So it is one of the most important programs in the state of New Mexico. And, we've taken this as an opportunity to, streamline the application process, as well as ensuring that New Mexicans receive continuity of services. Such examples are the Yes New Mexico real-time eligibility online application process and the introduction of telemedicine. Next slide, please. So a lot of the work that has been going on in the state with, and you can see here, the way the Emergency Operations Center for the state of New Mexico works is there's a lot of different emergency support functions. The Human Services Department is responsible for the coordination of emergency support function 6, which is mass care, which includes food and isolation shelters primarily. To date, since this disaster started, many HSD staff have been working to deliver over 2 million pounds of food to, many parts of the state. And in addition, we have 20 shelters set up, and we've been able to shelter almost 2,000 individuals since this COVID disaster started, and we continue to do that work every day. And I think it's just important to recognize that, in our shelters, people receive high quality behavioral health care. They receive regular check-ins with medical staff, and this is really a collaboration between Homeland Security, HSD, the Children, Youth, and Families Department, the Department of Health, and the Indian Affairs Department. So this has been a great opportunity to see multiple departments working together in new ways, to provide better services to the citizens in Mexico. So all I wanted to add is this all started with the example that the Income Support Division set. So anybody that receives services from ISD, that includes SNAP, Medicaid eligibility enrollment, and I think 15 other programs that the Human Services Department provides. All starts with the exemplary service that, as the child support director, I can recognize at the Income Support Division. But I hope our customers recognize the extra work, that we're trying to be where you need us to be, so that you can get the services you need. That's kind of the highlight, the high level overview that I have of the Human Services Department work that we've done over the last 3 months. So now we're gonna open this up for questions and feedback from the audience, and I'm gonna turn this over to Audrey. Thank you, everybody.
Thank you, Jeremy. Okay, so we're at the listening portion of our session, and I'm just going to review the ground rules that Carrie mentioned, and they're pretty flexible actually. So We're going to kind of play it by ear, but depending on how many folks are willing to share, we'll limit 1 minute per speaker with flexibility in increasing that time. We'll cap each question at about 10 minutes of participant feedback. And you can either indicate in the chat box or simply speak into the microphone if you'd like to share a comment, and we can unmute you. I'm also very happy to read any feedback you may write down in the chat. And otherwise, we'll try to keep the rest of the participants on mute so they have the ability to hear you. Okay, next slide, please. For our first question, we'd like to know what is going well at HSD for you, or in general. I know it's really hard to get started sometimes, and we're okay giving it a couple minutes, but feel free to chime in about what is going well at HSD. We'll give it another 30 seconds.
So I just want to remind people that they can also, if speaking is uncomfortable, put their question in the chat box. We're happy to, sort of use that as an avenue if that feels more comfortable for folks to give us input.
And you can also, in the chat box, direct your chat at a specific person, like you could send it just to me, and I don't have to share your name if you don't want me to. We can move on to the next question, but just so everyone knows, we have a final feedback slide that can be all encompassing. So if you think of something, you're more than welcome to chime in at that time. Next slide. If you could change just one thing about HSD, what would it be?
So I want to make sure, that we kind of make sure and people know that this is a safe space to speak and give feedback to us. This is really your opportunity to tell us if there's anything you think that we should be doing differently or better, things that we're not doing to address your needs, or things that we should keep doing to make sure, if you think we're doing things well. So this is kind of like the magic wand question. If you had a magic wand and you could have HSD just do one thing differently, we'd love to hear from you about what that could look like. So again, just want to encourage you to give feedback if you have any ideas, and not be shy.
For those who just joined, this is the Human Services Department's listening session, and we have coordinated this webinar to allow our customers and others that we work with throughout the state to provide us with input and feedback about how we can improve the services that we provide to you. I noticed that we had a couple of additional attendees join the group, and so we are at the point of our presentation. We've just reviewed some of the activities that HSD has conducted over the last few months, and now we're asking our participants, those of you who have taken time today to join us, we really appreciate it. We're asking you all if you could please provide us with any input you may have, specifically this question about what HSD can do better for you all. So please feel free to share.
And this is Jeremy Toulouse, I'm the Child Support Director. If anybody's nervous, this is not a group to be nervous about. You can absolutely ask those questions and make comments. We're all pretty full of candor and glad to discuss things as best we can.
I'll give it one more minute, and then as a reminder, you can, if you think of something, you'll have another opportunity to share what you'd like to change about HSD. We'll give it one more minute. Okay, so we have a comment, and this participant says, I would change the wait time on the phone. There has been a lot of time where I wait 15 minutes or longer to speak with someone. Thank you so much for sharing that. And this individual sent me a private chat, so you're all more than welcome to do that.
That's really good feedback. And I wondered if, Sean, would you like to talk a little bit about the Customer Service Center launch?
Sure. So we are in the process of launching what we call a new consolidated customer service center. We just launched yesterday for child support. So calls are now for child support will be taken by this new consolidated customer service center. And then the rest of our programs, services, and functions will go live on August 3rd. One of the features that we have with that new launch is the ability for you to select that you want to be called back. And you can be called back immediately when an agent becomes available so that you don't have to stay on the phone on hold waiting. Or you can schedule a call back for a later date and time that's more convenient for you. So that's one of the new features I look forward to with this new service. We're also, come August, launching additional channels that you can engage us over. So for example, chat and text will be new channels that we have not had in the past that are other ways that you can talk to us.
Great. Does anybody else have any feedback on if they could change just one thing about HSD, what would it be? We can go to the next slide, and then if anybody wants to chime in, they can continue to chime in. Thank you. What innovations do you suggest for improving HSD? So there's a follow-up from your information, Sean, that you provided. And the person says, that would be great. I not only deal with my stuff, but with my dad's. So there is time I have to call multiple times because they can deal only with one case at a time. It will be nice to have that option to have a callback or a set time for them to call back.
And if I may, Audrey, just to add, with the new Consolidated Customer Service Center, you should not have to call multiple numbers or multiple times to get multiple cases and issues handled. So this is a kind of single service that we're offering that they'll be able to provide any support that you need for any of the Human Services Department programs that we have.
Thank you, Sean. So I'll repeat the question that we're looking at on the slide right now. What innovations do you suggest for improving HSD? And as a reminder, you're more than welcome to send a chat or to speak using your built-in microphone. We can give it another minute and then feel free to send a chat or speak your input. Okay, next slide. How can HSD make it easier for our customers to access our services? Feel free to type in the chat box or speak.
One of the things I want to emphasize related to this question is that the department has really been thinking hard over the past 3 months, particularly in response to the COVID-19 pandemic, about how we can serve our customers in this new situation that we're living in. And it has really, it's been very difficult, but it has really driven a lot of innovation on the department's end to really make sure that, with all the closures and things going on, that we've been able to really maintain or enhance or improve customer service during this time. And so we really view this as an unprecedented opportunity to change the way we do business, to be a more responsive agency to our customers. So any feedback you have on how we can serve you better, really all ideas are welcome. We're very, very interested in hearing about this, particularly during this time of change. And so it's really a timely question, and we're very interested in your feedback.
Okay, we can give this question another minute, and I'll reiterate. How can HSD make it easier for our customers to access our services? And please feel free to speak your answer or type it in the chat. Josephine Quintana says, I have a thought on hold. Hold on. I'll hold on for sure. So they should be able to access help via I think there's more coming. Via a free kiosk system, which could be set up. So they should be able to access help via a free kiosk system that should be set up. Thank you so much, Josephine, for sharing that. At any state system.
Can I ask a follow-up question to that, Audrey? Josephine,
Yeah.
if you don't mind. When you say free kiosk system, do you mean at locations, certain locations, like non-HSD or non-government locations, or can you elaborate?
So at any state system that could help them if they don't have a cell phone or a computer. So anywhere, so at state locations, Josephine? Did that answer your question, Sean?
Yeah, I'm good. Thank you.
Okay. Thank you so much for that feedback. Would anyone else like to answer the question, how can HSD make it easier for our customers to access our services?
So thank you, Josephine, for that comment. That's very helpful. As Carrie mentioned earlier, HSD has been changing and modifying the way that we do business. So to your point about access to technology, if to apply for benefits online, or to use our call center, and if an individual doesn't have access to technology, what are the options? And so HSD has put a lot of thought into that issue. So thank you for asking about that. A couple of ideas. So our income support field offices are, during this crisis, are open 2 hours a day from 10 a.m. to noon to service those individuals who don't have access to technology. That is the primary customer that we are hoping to serve during those 2 hours. In addition, if a library is open, that's one way that individuals might have access to computers. We are also looking as a department at having a different type of service methodology so that if individuals in the future, much further in the future, after the pandemic is over, we would be looking to having those type of freestanding services in some of our field offices, so that customers can come in and apply online. We also have videos that will show someone who may have a cell phone only and not a computer at home how to upload documents to our Yes New Mexico website. I see that you're mentioning there are more state buildings and libraries, so true. So we are looking to modify our process to make that type of service more accessible in the future. Yes, and as Sean mentioned, Josephine, I don't know, Josephine, if you were on the line when Sean was talking about our consolidated customer service center. I think so, or that may have been a different question. So we're implementing a consolidated customer service call center that rolled out this month for child support, and eventually will service all of our customers that will be able to assist individuals with benefits over the phone as well. So thank you for that feedback.
Thanks, Angela. Any further feedback is welcomed on how HSD can make it easier for customers to access services. All right, we'll give it another 30 seconds or so, and you're more than welcome to chime in. If you think of something you'd like to say to this question later, we'll have a final feedback section. Okay, next slide. How can HSD improve its communication with you? Sean shared in the chat that there is a federal program that helps to cover the cost of mobile phones and internet connectivity. And Sean posted the link in the chat as well. For anyone on the phone, it's https://www.lifelinesupport.org. So how can HSD improve its communication with you? You can take another minute or so to consider the question, how can HSD improve its communication with you? And if there's anything that you'd like to share from previous questions, you'll have another opportunity to do so. So Vanessa says, I think the communication from HSD is pretty well. You always have up-to-date info on what is going on with HSD or what programs there are. Online yes.nm is great, as well as the HSD website along with your Facebook page, especially with this new normal. One thing though, maybe have some info a little more clarified. Vanessa, can you give information or or an example on what kind of info you would like more clarified? And thank you so much for that feedback. Take your time, Vanessa. Vanessa says, yes, give me a minute. I know I put you on the spot for a little clarification, so you're more than welcome to take the time you need. Anyone else is also welcome to chime in at any time.
So Audrey, as Vanessa is typing, I just wanted to share that I really appreciate her feedback. But for those that are unaware, our HSD website also has an email box where comments can always be submitted to the department. And Ashley Espinosa, who's part of our communications team, pushes out messages via social media to our customers regularly. And I know that when we do press releases, we work really hard to make sure that the message we're sending out is clear, and sometimes we just miss that mark because our programs are complex and there are many of them. And so recent press releases include information about the July SNAP supplemental benefit, which means that we have received federal approval to be able to provide households with the maximum SNAP benefits for the month of July. Again, I think this will be the 5th month HSD has received federal authorization to do so. And with PEBT, Vanessa, thank you so much. There has been some confusion about PEBT. So this is the benefits that HSD was also authorized to provide, SNAP benefits that HSD was authorized to provide to households with children who qualify for a free and reduced lunch program through the Public Education Department. And HSD had to work very closely with the Public Education Department to obtain those addresses for those families who qualify for free and reduced lunch. And we had some issues with the addresses being accurate. And we wanted to make sure, we want to make sure that those EBT, those SNAP benefits go to the correct household. So we have delayed the second phase of the release of those EBT benefits, and they should be going out next week. And so our latest press release, which I believe is going out this morning, Ashley, you can correct me if I'm wrong, will include phone numbers, a couple of different phone numbers for people to call if they would like to find out the status of their PEBT benefits. So thank you for that feedback.
Thank you, Angela. I'm just going to take a moment to read what Vanessa stated so that folks who are listening in can hear what you responded to. Vanessa says, so with the PEBT stuff, there was a lot of confusion about it. I follow your Facebook page and I notice a lot of people just keep asking the same questions about it. Not alone that the way it was put out there is everyone who had children in school qualified if they got free or reduced lunch, but people still wonder if and when they will receive it. And I believe you answered the statement, Angela, and Vanessa says thank you. I really appreciate your feedback, Vanessa. And would anyone else like to contribute to the question, how can HSD improve its communication with you? And we can give another minute. And if you'd like to contribute, please do. Okay, we can move on to the next question. And again, if you would like to answer this question, you'll have some time at the end. This is the end. Do you have any additional feedback? And this is the time if you want to say something about something we didn't ask about or answer a question from the beginning, you're more than welcome to either use the chat or to speak your answers. Thank you so much. And I also want to thank all the people who are listening. This has been a great opportunity for all of us to listen, whether you're a participant or part of HSD. Thank you so much.
Okay, well, I think happy to give it additional time. I'm not seeing anything else come in through the chat. So, you know, I want to start out, I guess, as we wrap up by thanking all of you for joining us. I know that it can be very challenging to offer feedback in this format. This is the department's first real sort of effort at doing listening sessions with customers, and so you know, this we're going to learn as well from this and see what we can do to improve these sessions. But just being here shows your engagement, and so we really thank you for that, even if you were really quiet today. So we do appreciate you being here. Let's go ahead and move to the next slide, please. So if there's anything that you were wanting to say today but you felt uncomfortable about, we want to make sure that you have, we offer you additional ways to give us feedback. We are asking for feedback by Friday, July 10th, related to the questions that we've been asking, because we're really trying to analyze that information so we can do everything we can to improve our business processes in the coming weeks and months. So we are going to use that information to see how we can improve. So we do have a customer service survey that's posted. It should take no more than 5 to 10 minutes to complete. So please go to the SurveyMonkey link that's posted there and feel free to give us feedback. You can also email us your feedback at hsd-publiccomment@state.nm.us, or you can send us feedback in the mail at Human Services Department, attention, HSD Listening Sessions, PO Box 2348, Santa Fe, New Mexico 87504. And just if you weren't able to get that information, but you do want to provide us with additional feedback, we will have these, I believe they're actually already posted. These slides are posted in English and Spanish on the HSD website. So please feel free to go there and pull this information off so you can do the survey and give us additional feedback. Next slide. So HSD did 2 listening sessions yesterday, the second of which was for Spanish-speaking customers. It was a great session. We got a lot of feedback. We have one more session after this today from 4 p.m. to 5:30 p.m. So if, please feel free to join us then if you think of something that you'd like to say, or if you just like a repeat, and then we'll be wrapping up. And we, as I mentioned, we'll be analyzing the feedback provided on all of the listening sessions, and then we will make that information publicly available. So with that, I do want to say there was a comment, another comment from Vanessa, saying thank you for the time doing this, and hoping that next time more people will attend, and recognizing a lot of people always complain about our services. Well, that is true, but it's great to hear positive feedback and constructive feedback about how we can do better. So thank you so much for participating today. We really appreciate all of you being here, and look forward to doing more of these sessions in the future. Thank you, and we'll wrap it up there. Bye.